The videos of Swot nurse notes serve as worded explanations and for demonstration purposes only. These notes are based on the owner of the channel's understanding. The channel's purpose is to assist with studying and to help with adapting to the UK clinical setting. These notes are short and simple for persons to better have a foundation knowledge to build on. This, however, does not serve as a specific guide to the NMC OSCE and CBT exams. Hey everyone! Did you know? There are recommended target blood glucose ranges? The answer is yes. According to the National Institute for Health and Care Excellence guidelines, these ranges are for persons who are non-diabetics and those with type 1 and type 2 diabetes. Before meals, persons with type 1 and type 2 diabetes are expected to have a blood glucose level range between 4 to 7 millimoles per liter. After meals, persons with type 1 are expected to have a blood glucose level range between 5 to 9 millimoles per liter. However, for persons with type 2 are expected to have a blood glucose level range less than 8.5 millimoles per liter after meals. Despite not being diabetic, there is a target blood glucose level range before and after meals. Before meals, a target blood glucose level range is between 4.0 to 5.9 millimoles per liter. After meals, you should have a glucose level range less than 7.8 millimoles per liter. Of course, we can't leave the children out. After all, they too can have diabetes. According to the National Institute for Health and Care Excellence guidelines, before meals, children with type 1 diabetes are expected to have a blood glucose level range between 4 to 7 millimoles per liter. However, after meals, blood glucose level range is expected between 5 to 9 millimoles per liter. Yes, there are different treatment options available and everyone's situation can be different. Here listed are treatment options available for diabetes. Remember, treatment is based on the type of diabetes in addition to if other health conditions are present. Types? Not mine. Yours? Haha, lol. Now, let's look on the types of insulin. I hope I still have your attention. We have so much more to discuss. Displayed are the types of insulin available for persons with diabetes. Remember, these are given depending on the readings of persons over a period of time and the sign and symptoms experienced. These include short-acting, intermediate, and long-acting insulin. We are now going to look further into the types of insulin, starting off with short-acting insulin. Short-acting insulin, as the name states, short, has a short duration and a relatively rapid onset of action, to replicate the insulin normally produced by the body in response to glucose absorbed from a meal. There are two insulin that falls under this category: soluble insulin and rapid-acting insulin. With soluble insulin, it can be human, bovine, and porcine. Bovine or porcine, both are rarely used. It can be given subcutaneously, but some preparations can be given intravenously and intramuscular. It is usually given 15 to 30 minutes before meals, depending on the insulin preparation used. Soluble insulin has a rapid onset of action 30 to 60 minutes, a peak action between 1 and 4 hours, and a duration of action of up to 9 hours. When injected intravenously, it has a short half-life of only a few minutes and its onset of action is instant. It is used in diabetic emergencies. The brand names include Act Rapid and Humulin S. For rapid-acting insulin, there are three types. These are insulin aspart, insulin glucosine, and insulin lispro. Rapid-acting insulin has a faster onset of action, 15 minutes, and a shorter duration of action, 2 to 5 hours, than soluble insulin. For maintenance regimens, these insulin should ideally be injected subcutaneously, immediately before meals. It has an advantage over short-acting soluble insulin in terms of improved glucose control. The brand names include Apidra, Humalog, and Novorapid. Intermediate-acting insulin, also called isophane insulin, is a type of insulin that is injected once or twice a day. It works throughout the day and night to provide low levels of insulin all the time. Intermediate-acting insulin, also known as basal insulin. Brand names include Insulatard and Humulin 1. Both can be given by subcutaneous injection, onset of action, 1 to 2 hours, a peak action of 3 to 12 hours and a duration of action of 11 to 24 hours. Long-acting insulin. As the name suggests, long has 3 main types. 1. Insulin detamere, with brand name Levemir. 2. Insulin glargine that includes brand names, Abisaglar, Lantus, Semglee and Toujeo. 3. Insulin degludec, with brand name Tresiba. Duration of action may last up to 36 hours. Long-acting insulin achieve a steady state level after 2 to 4 days to produce a constant level of insulin. NICE, 2024. Insulin detamere is usually taken twice a day. Insulin glargine and insulin degludec are usually taken once a day. Biphasic insulin. Yes, this is a mixture of short-acting or rapid-acting insulin and intermediate-acting insulin. Usually it can be taken twice a day, about half an hour before breakfast and evening meal. There are 3 different types of biphasic insulin. 1. Biphasic insulin aspart, brand name Novomix 30. 2. Biphasic insulin Lispro, brand names Humalog Mix 25 and Humalog Mix 50. 3. Biphasic isophane insulin, brand name Humulin M3. Onset of action, 1 to 2 hours. Duration of action, 11 to 24 hours. Maximal effect at 3 to 12 hours. The recommendations on the management for children and young persons with type 1 diabetes are displayed here on screen. As you can see, there are many recommendations relating to the management of type 1 diabetes. The goal, however, is to always optimize the effectiveness of care and reduce the risk of complications. Same here for adults with type 2 diabetes. The recommendations on the management for persons with type 2 diabetes are slightly different than those for children. But at the end of the day, the goal is to always provide appropriate care, promote especially self-care and provide support for people living with type 2 diabetes and/or their family or carers. Minimize the risks associated, as well as to screen for long-term complications of diabetes. The complications? Oh no! This makes matters worse, and therefore we as healthcare workers stresses the importance of healthy lifestyle changes. These can minimize the risk of long-term complications of diabetes, such as cardiovascular disease, peripheral arterial disease, dyslipidemia, kidney disease, retinopathy, neuropathy, and psychosocial issues. Now for the nursing aspect. Here listed are common nursing diagnoses in which scenarios can be based on for care plans to be developed. These are as follows: wound infection, risk for infection, impaired comfort, risk for unstable blood glucose, urge urinary incontinence, acute pain, ineffective coping, anxiety, depression, malnutrition, risk for malnutrition, loss of appetite, disturbed sleep pattern, loneliness, ineffective health management,